Hello, mamas. Welcome back to another episode of Mom's Abilities. Today, I am joined by Dr. Leslie. She is based out of Tennessee, US, and she is a board certified pediatrician. Also, she is in practice for over 2 decades, I believe 24 years now, right, Dr. Leslie?
Yes.
With her expertise, today we will dive deep into a lot of topics related to infant care. And let me tell you, these are not like superficial level generic things that we are going to discuss. We have figured out things that are contradictory all over social media where people have invalid perspectives and things that are not really supposed to be floating around. So if you're a mom who's confused looking at those reels who are like intimidating and not really valid, please stick around. New parents, moms to be, parents to be, stick around, watch till the end. I would also like to mention that Mom's Abilities is now available on Apple, Spotify, and Amazon Music. So please do subscribe so that you don't miss any of these important episodes. So, Dr. Leslie, before we start, I would like you to give a little bit of a background about yourself and about your practice. Of course, we know it's been 24 years, but like a little bit of a brief about yourself.
Sure. I live in Tennessee, as you said, and I grew up in Alabama and went to school, grew up there with my parents who actually still live there, but went to school at Auburn for college and then University of South Alabama for my medical school. And then I became a Tennessean in 1997 when I started my residency at East Tennessee State University. So I moved here and did a pediatric residency, and then one of my friends from residency recruited me to come to the town that I'm in now, and I've been here ever since. So I've been in a private practice, pediatric practice, for 24 years in October. So I have two children that are grown, and I've been divorced for about 12 years, something like that. It's hard to keep up with it anymore, maybe 13. But my children, so I've got some experience both as a married parent and as a single mom. So that was something I never expected to navigate, but it made me grow as a person in a big way. But I'll back up just a little bit and say I had my first child my son, when I was right before I started my residency program. So that was an extra challenge, and I breastfed him. So I carried that breast pump everywhere I went, and it was hardcore. So, and then I finished residency, and I was pregnant with my daughter when I finished, and had her a couple of months after I finished, and then we actually had an emergency delivery. She was a little bit preterm. She was like 36 weeks, and we had a complete placental abruption actually, and I was at the hospital, had an emergency C-section, and came out of it unscathed, but it was very scary. And I was anemic for a while and actually struggled that whole year. And it was my first year of residency, so I don't know how much of the C-section experience or the transition, like the major life transition that I had, contributed, but I had a major bout of postpartum depression actually that year. That was my first year in practice, and I didn't tell anybody, which I don't advise. So I've got some feels for mamas who are going through that, because it's very complex, and came out of it after about a year. I probably could have used some medication, but it all turned out okay. That's a very complex condition, a lot of hormones involved, but also just situational things, and maybe not such good emotional health, which I kind of learned more about later. So, but anyway, I about a year and a half ago, I've been in practice for all these years, and I decided to enter the social media space. I've actually got a course for parents to prepare them for the newborn phase, like understanding what happens at delivery and that sort of thing. And that was kind of how all this started. And I needed to get my name out there and kind of share good information with people. And then it's kind of turned into a mission of sharing information to battle misinformation based on the environment that we're in right now. So, anyway, it's been a lot of fun.
Yeah.
It's been a lot more fun than watching reruns.
Yeah.
And I've actually learned a whole lot in the last year and a half. It's been a very huge growth experience for me.
Amazing. Sounds good. Anybody who has not seen Dr. Leslie's Instagram, please go and see. You'll find a lot of information there. There's like, I don't know how many reels she has on the topics that you question yourself every day. Whether should I feed this to my baby? What to do when the baby's feeling this? She has a lot of reels. That's how I actually found her and I reached out to her. So do check out our Instagram. It's going to be very valuable for you all. And yeah, Dr. Leslie, like you said, transitioning into motherhood itself is like a life altering experience. And I
Yes.
mean, by hearing your personal experience, I'm sure like a lot of moms who are questioning themselves, like, why me? Am I the only person who went through this or who felt this way? So it's kind of reassuring for them.
Yes. And not everybody has the as stable of a situation as even I had. So that's very much compounded if you're by yourself, or if
Yeah.
if you're having marital problems, relationship problems, that sort of thing, if you don't have a lot of family support, which actually I had. So I recognize that it can be much worse than what I had. So
Yeah. Dr. Leslie, in today's episode, I would like to dive deep into infant care and simple topics like digestion, and there's a lot of information floating around about vaccines. I would love to talk about those things, but before we dive into infant care, I want to ask you, being a pediatrician, what kind of differences would you say you have seen in the infant phase and toddler phase? And it could be anything. I'm just asking for, parents like sometimes they don't know what to expect. Like it could be any change, behavioral, scientific, anything that you would like to talk about.
well, I made a few notes. So if I'm glancing this way, it's because I'm looking at it.
Absolutely.
So I made some notes about the differences that I see in parents in the infant versus the toddler phase. Parents are tired and they really struggle with mood in the beginning, I think, because of the lack of sleep. And so there's this exhaustion factor that plays into all of that. And I think they're more anxious in the infant phase about different things. There's always something to worry about, right? But but when you are in the newborn phase, you're just like latching on to the fact that, hey, I'm responsible for this little person, and it's kind of scary. So they bring a list, and I think that's fantastic. Actually, when somebody shows up with a list, they're always kind of embarrassed about their list, but I think it's good because it gives us something to kind of work off of. And when your tired brain can't think, that's definitely a good thing. But toddler phase, parent wise, I think a lot of people have gained a lot of confidence by then. And the levels of anxiety of I can't do this, or what am I doing? That kind of thing, that has dissipated. You're more rested, but you're tired in a different way because the baby or the toddler a lot of times is very attached, and it's hard to get a moment alone. Like you can't even go to the bathroom by yourself, and it's so complicated. And I think people are stressed in a different way. Plus, you're trying to keep this toddler alive because they don't understand all the risk.
Yeah.
It's very stressful. I remember how hyper vigilant I felt like I had to be when my kids were that age, because not only was I a new mom, but I was in pediatrics and I was seeing all the things that can happen in real time. And yeah, so you talk about being hyper vigilant, and it's a complicated place to be psychologically, really, but
Yeah,
it was
I mean,
good.
for me, I am all the time worried. Like, if I leave him in the diaper station for 2 minutes, I look somewhere else and I'm like, I will look at him like 20 times. And I know my husband is saying, like, right now, he's not even crawling or running. Make yourself little strong. Don't be like that.
Well, you can't really trust them, though. I mean,
Yeah.
sometimes newborns flip over. So,
Yeah.
yeah. Yeah. So I think one of the other things I was going to say is the hormone shifts that are going on in those first few weeks, and the sleep deprivation, and then the worries about health and safety are all big things, but there's that shift. So yeah, like the what you worry about is different, but you're still stressed. And I think in most cases, and trying to figure out like, how did this behavior start? What do
Yeah,
I do with this? This tantrum thing.
absolutely. In terms of the baby itself, like infant and toddler, a lot of times people say like, "Oh, my baby's so calm," right? An infant like so calm and not notorious at all, and then turns out to be when they hit the toddler stage, it's like a completely different human being,
Mm-hmm.
right?
Yep.
So, what kind of things that in your practice, like everyday basis, you might be getting some parents who come to you like, oh, he was not like this, but he was not like this, and now we are glad he's like this. What kind of differences in terms of the baby and the toddler we can expect or think of?
Well, I think when they're an infant, they obviously don't have that mobility, and it depends on their personality. There are babies that are very calm infants that do, and that was kind of my daughter. She turned into the Tasmanian devil when she turned into a toddler, but uh, oh, she was a lot. Um, but when your infant is very needy, say for example they have a milk protein allergy, and they're fussy all the time. They cry and cry and cry, and you can't figure out why they're crying, or they're, whatever. If they have some issue going on, a lot of times that's ironed out by the time they're a toddler. And if their personality is pretty laid back, then they might be just fine. So, they're, and the toddlers, no matter what they do and how they behave, they are so cute. Oh my goodness. They say the funniest things, and they just have such a fresh perspective about everything. They're just so much fun. I love them. And they'll give
Yeah,
you the hugs at the best times.
right.
Yes.
If we move on to, let's say, talking about milestones, there
Yes.
is a chart that we have, like doctors will say this is the time period when baby should do this, that. Anyway, sometimes it's not the same for every baby. Some babies might be starting doing something early, some babies would do it later on. What are your thoughts for the parents who are constantly worrying about these things?
So this is obvious, but worrying doesn't change it.
Absolutely.
Um, you're not going to change anything by worrying, but I get it 100%. But I would say that there's a range of normal. And I think if your baby is, and your pediatrician can help you iron those things out. We do follow, and if you look at it, we do follow something called a Denver Developmental Milestones chart. It was created in the 1960s, and it's still something we use. I actually have it in one of my little books over here in my shelves, but everything in there is it's like a time graph, and it's little bars that cover that period of time. And your baby's, if your baby's premature at all, so if they are one day below 37 weeks, then they get extra weeks for that milestone to happen. So if they're 36 weeks, they get 4 extra weeks to meet that milestone, plus or minus whatever that norm is. And some of that I find is personality dependent. Some of it is how much they're nurtured in that way. So I've had babies who have great parents, but the mama holds the baby all the time and they don't get enough tummy time. And if they don't get enough tummy time, they don't develop their core muscles well enough, and their neck's not quite strong enough, and they struggle with those motor milestones those first few months. So there's some guidelines about, so that tummy time, kind of gets them to where they needed to be, right? So,
Yeah.
so there's some of that. If you had a parent that was really struggling and they didn't talk to their baby enough, sometimes those babies don't develop that speech and language well enough. But most of the time, it's, if you've got a whole spectrum of approaches and babies and all that, so it's very complex. It's not usually something the parent can control. Most people are
True.
doing the best job they can, and
Hmm.
Every baby's different, and some babies develop at different rates. Some babies are going to be shown to have autism when they get older, and sometimes their development is a little different. And we don't know those things at those times, so we tend to follow that development. But I've had babies who, I wondered about, and then they just caught right up. Like they just, so it's each situation is individual, and babies should be looked at individually by their doctor.
Definitely. And like you mentioned, that a baby who's like maybe a bit premature might take extra time
Yes.
to reach that milestone. And similarly, if a baby comes late, right? For example,
The late, not
or
really. We kind
really
of just count those as right on time. Like it,
got it.
yeah. Because we don't tend to see that many late babies because of the risk that's associated with going post dates. Most
Mm-hmm.
babies end up coming closer to that due date. So you don't see a lot of really post term babies.
Yeah.
So it's mostly going to be what we're focused on is, if you're a 30 weeker, you're going to get 10 extra weeks of
Mm.
development time. So
True,
when you're
true.
4.5 months, you're going to be acting like a 2-month old. And
Got it.
that timeline applies until you're about 2 years old.
Oh, okay.
Yeah.
And
And they,
then things
they
change
should,
after 2 years.
they should be caught up by age 2. And the same thing applies to growth charts. So they have a different growth chart, and you can look at the preterm growth chart or you can look at the full term growth chart, but those converge at age 2.
Got it. I would like to move on to feeding and digestion.
Okay.
And like I mentioned, like I want to talk about starting solids because I also have an infant myself. He's like gonna turn 6 months very soon. So
Nice.
I'm kind of on that route to, I'm trying to educate myself a lot on what's best, what's not best. But of course, having social media, there's all kind of information, and some people are advocating for giving just purees, and other people they are talking about introducing some carnivore diet. So firstly, I would like to understand what is the best time to start solid, what kind of cues we are looking for in the baby, and what kind of food you really suggest to start with.
Okay.
And when we are
So
thinking about what kind of food to start with, like whether the baby has teeth or not, because again, some babies don't get teeth for like 8 9 months too, right?
let's just go ahead and answer that question right now. Babies don't
Yeah.
need teeth to eat solids.
Thank
They
you.
don't have.
Thanks for that.
Nope. So don't
Okay.
worry. Don't even
Perfect.
worry about that. Yeah.
Perfect.
So, timing wise, you read different things. AAP, American Academy of Pediatrics, says 6 months. There are some governing bodies or recommendation bodies that say 4 months, 4 to 6 months is kind of your time frame. Before 4 months, there's some evidence, potentially a little controversial, but some evidence of an increased rate of obesity when you get older if you introduce solids too early. Plus, most babies are not developmentally ready at that point, like when they're 2 months old or whatever. So, when you get to about that 4 to 6 month mark, most babies can sit up. They can take something from a spoon and they won't push it back out of their mouth. They'll, once sometimes they do push it back out of their mouth at first, but they learn. So they're teachable. And if you start somebody on solids and they do that tongue thrusting thing, you can just try again in a few days. It's all a learning process for them. As far as what you introduce, there are not hard and fast rules. There's kind of typical things that most pediatricians will guide people to just because they're easy, but it's a very individualized choice. I don't think that feeding a baby a pure carnivore diet is a great idea because babies need complex carbs and they need fiber and they need vegetables and fruits and vitamins that come from natural sources and that sort of thing. So I think it's fine to use meats, to introduce meats relatively early on. And it's kind of just depends on what you want. The biggest things to be concerned about are going to be like choking, allergies, and that's a whole conversation. The whole allergy thing, we can do a little brush of that. But as far as what I usually recommend a combination of purees and solids. And if your baby has no established food allergies, then you should be fine to do one food per day. That should be just fine. And always discuss it with your pediatrician before you do anything, of course. But if you want something easy to start with, most babies do really well with just plain oatmeal cereal, like baby flakes that you buy at the store. Mix it with some breast milk or formula, and then just soupy and thin, and start with just a little spoon feeding. And then I usually will have them progress through the different grains just to get some iron rich foods in their diet. So maternal iron stores are gone at 6 months, by between 4 and 6 months. And so having additional iron in the diet, especially with a breastfed baby, is really important. So the meat could definitely suffice for that, but that's a whole thing, and there's definitely some social media trends about all that. But I think I would be just cautious about what you give them so they don't get choked on it.
True, yeah, and I agree with you. Like, why not just do combination? Because even as adults, can we do like completely 100% carnivore diet? I mean, there's a different kind of trend going with that too. I've seen people doing all carnivore diet, but with babies, like we can try to combine different nutrients.
That's
Yeah,
I
we
don't
can do
know.
that.
I don't know. I don't think so. That's just my initial reaction to that. That seems to be more of a social media trend than an evidence-based practice. So I don't think there's validity to just feeding meat or something like that. I think the baby would be missing a lot of nutrition and experiences with different textures, right? So we want them to be able to take all the different textured foods and learn how to map those things out in their mouth. Kind of don't.
Okay, so Dr. Leslie, there's a lot of things going around about meat based nutrition where people are trying to incorporate, let's say, whipped bone marrow and chicken liver, beef liver. And there's talks going around that baby's gut is leaky. And again, I am not sure if there's any evidence or anything, but what do you think about a meat based nutrition? How to approach that? Or maybe how to incorporate these things with other items?
Yeah, I think it's fine to include some meat in a baby's diet. I think if you look at cardiovascular things and lipids and things like that over time, probably a combination of foods is better. Plus, the baby's nutrition profile is going to be better if they have vegetables and fruits. And I think the biggest thing to avoid in an infant's diet is processed things, junk food. And
Yeah,
I think if you have a nice combination of those things, it's fine to use meat and it's fine to use, but I would just keep things very healthy.
got it. Okay, I'd love to talk about this topic, which is about salt and sugar. When should we add salt and sugar to a baby's diet? And there's a lot of things again, how grandmas and elders of the family, they say like the baby is not going to have taste in the food, right? But then there's theories that say like it's not healthy. So what is your stance on this, and what do you suggest to new parents?
So there's even some theories about what babies are exposed to in utero, like from what mom eats and probably through the breast milk as far as like affecting preferences later and stuff like that. So I do firmly believe that we are kind of mapping what somebody's preferences are from very early on. And I didn't realize any of this when I was pregnant and had small children, but I did recognize the importance of feeding healthy foods and things like that. But I'm talking about like compared to like what I ate. It's it's actually more important than we previously knew. So I think that early introduction of really salty things or really sweet things can kind of, it probably affects their brain and how their cravings and their desires and what they want. So I think if you can leave those things out, obviously excessive sodium can be a health risk. It can cause bone loss, and it's not a great thing for anyone. But if we teach them to not really desire those things early on, then I think it's probably easier for them to just say no to it, when they're older. So I think the excess sugar, obviously, sugars are kind of in a whole category of things. So the word sugar has been demonized a little bit, but literally it's glucose. So we got to have some of that to live, right? So we don't want our baby on a no carbohydrate diet. We don't want them to not have any sugars. But as far as excess additional sugars, it's a good idea to avoid those things. And like fruit juice is not recommended before they're 1. And honestly, I don't recommend fruit juice for most babies anyway. But things that like sweet drinks and candy and stuff like that, it's good to kind of hold off as long as you can. I live in the real world. I understand, but at some point it's going to happen. But if you can wait a while, you maybe that you're forming that child's taste buds and the way that they desire things.
Like, of course, we should not introduce to packaged food or candies and
Yeah.
chocolates, but for like infants and toddlers, we could just give like a banana or pomegranate. That's like natural sugar, right? It's still gonna satisfy their taste for sugar that they're craving, maybe.
Yeah, for sure. Well, and I mean, hopefully they're not having cravings yet,
Craving, yeah.
right? So that's one of the things I talk to parents about actually is when they're over 6 months old, when you're going to give them something additional to drink, make it water because you're teaching their brain what to expect when they drink
Yeah,
something. So if all they ever drink is something that's flavored, one day when you hand them a cup of water, they're not going to like it, right?
yeah.
So if you do it from early on, then they just know. Plus what you
Right.
model. So if you're doing that same thing, that also
Hmm.
helps.
Yeah, absolutely. Moms have to give up these eating these things too, because what? Look at your baby. They're watching. They're gonna want to eat it,
Right.
right?
They want what you want.
And then I've seen on your social media, and that's how I actually wanted to talk about this. I want to talk about botulism,
Yes.
and there's one thing, honey, which has been like the biggest factor in this, right? And of course, there's some more foods. So I wanted to shed some light on that. Why do we say that honey should not be given under the age of 1? How does that affect the infant? And kind of let's move on to also what other foods to be considered, scary. So that's what I'm trying to
So
understand.
there's two different disease processes. One is infantile botulism, and then you have regular botulism. Regular botulism can happen at any age, and it comes typically like from canned goods, from a wound, something like that, because Clostridium botulinum is the bacteria and it lives in the soil. And sometimes those things can get the toxin, is what affects, like in regular botulism. In infantile botulism, they can get it from honey. It's actually, I mean, I've seen it before. It happens. You'll see if you ever work in a children's hospital, you'll see it. About in the U.S., about total of botulism itself is about 100 cases a year. And then there's only like 20 that are actually from honey. Still an important thing to know because you don't want to be one of those 20, right? So it's what happens in that process, though, is sometimes honey can have the spores of Clostridium. And I think it would only affect infants and potentially, like if you were an adult that had a compromised immune system, that might could affect you this way. But the infantile botulism is where the spores get in the infant's gut, and then the spores start producing that toxin, which leads to a paralysis. So it's like a paralysis that starts on the face and moves down the body, and it can affect their breathing, can make them constipated. It's pretty dramatic. Like it's, but it can be subtle. Sometimes when it starts, sometimes the eyelids will droop and they'll get facial weakness. They'll have difficulty feeding, and then it kind of progresses. So ideally, somebody's going to figure that out. A lot of times, babies get it from environmental dirt, like dust. So if you're
Wow.
living near a construction site, just being careful about exposure to the stuff that's getting stirred up in the air. And
And
careful
Dr.
hand
Hussein,
washing and stuff like, yeah. So a lot of times dirt is one of the things that leads to it. Same disease process, but yeah, it's most of the time they don't identify the source.
Yeah, and I'm also worried like babies who go out and play in the soil, they have to come back home and wash their hands the first thing. Are you also saying that the soil could be risky also?
Yeah, so your infant shouldn't be in the soil, but
Mm-hmm.
once you get about, they say 12 months for honey, your risk of infantile botulism gets much lower as they enter that toddler phase and pretty much goes away because their gut matures. So their gut can handle those things a lot better. So it's really not a concern when they're old enough to be outside playing like that. It's really not. I don't think you need to worry about that. Like that's typically the peak incidence of this is about 3 to 4 months. So they're still pretty young. And I think they
Mm-hmm.
say a year for the honey just because that's a safer zone as far as knowing that the gut has matured past that risk. Does that make sense?
Absolutely, yeah. Yeah. Um,
So it's a long process, and so and there's a spectrum of disease probably related to how much exposure they had, like how much bacterial load they had, and
mhm.
if they have a huge amount, potentially could need respiratory support, for a while. But it does wear off, and there is now an immunoglobulin that can be given to reverse it. It's just the main thing is recognizing it, and then
Yeah.
doing what we can to avoid. Right, so and actually, um, in some of the looking things up as I was just refreshing myself, I ran across a study about they did a study on a baby who passed away from SIDS, and there was botulism found in that baby's body, and they found it in the environmental dust. So sometimes things happen, that we just can't control. But yeah, anyway, kind
So
of wild.
we really, really need to be careful. Like
New
sometimes
fears unlocked.
people,
Yeah.
yeah, sometimes people underestimate these things, right? I would never even imagine that there's a construction site close to my house and I have to be careful when I'm taking my baby out. Who knows?
Yeah, I
Wow.
know. Yeah. Well,
New fear unlocked.
you gotta live your life, right?
Yeah,
And
yeah,
I don't think you can sit around and just obsess about all these things and still enjoy life. So,
yeah.
that's why you need good pediatricians involved
Mm-hmm.
if you've got a baby and you need, to be able to lean on them and
Yeah.
let them help you.
Truly, yes. No, we have to live like our happy life. We cannot be worried all the time.
Right.
Just that let's not underestimate certain things, right?
Rest.
And then moving on to allergens, I want to ask how can we introduce nut butters or maybe any foods like that could be giving allergic reaction? What's the right age to introduce it
So
to a baby?
there's always a little confusion because the guidelines have changed in the last 30 years. So 25, 30 years ago, the guidance was to avoid all of these certain foods until they're two. That's what they used to say.
Yeah.
And now, what science has uncovered is that earlier introduction of these foods is actually associated with desensitization rather than sensitization to those allergens. So it's more important. So it's very important for all babies to get exposure to those proteins. And I think breastfeeding probably helps, but you can start introducing those things at 6 months no matter how you feed. And if your baby has a milk allergy, it's actually probably more important. And I've seen the pediatric allergist recommend, and I know this is a guideline, to give peanut protein 3 times a week starting at 6 months and give that all the way through age 5. 3 times a week. Yeah. So
Wow.
that early introduction is important. You can do that in different ways, and you should always ask your pediatrician before doing any of this stuff. But one of the ways that you can do it is with peanut butter protein powder. I don't know if you've ever seen that in the store, but
Mm-hmm.
it can be given like a teaspoon 3 times a week in the bottle. You can also do a really small amount. So you want to be careful with nut butters because of the thickness of them. So the choking aspect of that's a concern. But you can take just a really small smear and just put a really tiny amount in your baby's mouth, that kind of thing. So, but always let your pediatrician guide you on those things. I'm not here to give
Mm-hmm.
advice, of course, but that's just that's just one example. But I think exposure to all those other proteins is actually important. and doing it early.
Okay, just a little smear is fine, and of course it's so thick. That's what I was wondering. I see these moms sometimes they are having like a spoonful, and I'm like, no, it's that spoonful will make me choke sometimes, right?
Right,
It
right,
makes you
exactly.
dry.
Yes. Yeah, so just a
Okay.
little bit's fine. And then when they get older, you can spread it on a cracker. You can do whatever, make them a
Hmm.
peanut butter and jelly sandwich. Or I
I'm
have,
not sure about the protein powder that you're talking about. Maybe I'll take a look into that. What kind
mhm,
of powder is available? Because that's like very easy, right? I can even mix it with the breast milk.
right. Or if their baby's taking formula, you can just mix it with that. And if
Yeah.
you're breastfeeding and if you eat it yourself, your baby's already been getting exposed.
Wow. Yeah. Kind of
Oh, for
indirectly.
sure. Yeah. Peanut protein is going to go through the breast milk.
Hmm. Maybe I should have a scoop of peanut
Maybe you
butter.
need a peanut butter popsicle.
Yeah. Okay. Now this is something recently like controversial, right? And I also personally don't I have a beef with the people who are against it. I think you and I are both on the same page. I'm talking about vaccines. Okay. We see a lot of moms who are dismissing vaccines these days. There are moms who have had a toddler who has a toddler now. They got the vaccine, but with the new babies, the second babies, they are choosing not to do it. And then I remember I saw one of your videos where you reacted to Neil deGrasse Tyson's video,
Mm,
and he was talking about how more people are surviving these days compared to back in the days where we were living in caves,
right.
right? What are your thoughts on this, and how do you react to moms who are worried about giving vaccines? What would you say to them?
Well, I would say that you need to have a one on one conversation with your pediatrician and don't just go by what's said on social media. That's
Mm-hmm.
number one. Um, I think if you look at history, you'll find that we've moved the needle, so to speak, in a huge way. So, and I put some statistics on my list here, but in 1800, the mortality rate for children until age 5 was 46%. Just let that
That's
sink in
yeah.
for a second. So you have 10 kids, 5 of them are going to make it to their 5th birthday. Yeah. So huge, huge, major strides. And some people will argue oh, that's sanitation, that's indoor plumbing. And yes, those things are huge. Pasteurization of food, which is just heating it to 160 degrees Fahrenheit for 15 seconds, gets the dirty germs out of the milk and keeps people from getting deathly ill from drinking cow's milk. So those simple things, understanding germs and understanding about hand washing and about keeping your food clean and things that has all come about in the last 200 years. Refrigeration,
Yeah.
think about electricity, whatever. But then
Mm.
there was a huge change in the last 100 years. So infant mortality in 1900 was 165 per thousand kids. And then in 1997, it was 7 per thousand. And then in 2020, it's it's actually still 7 per thousand in 2020 compared to 46% in 1800. So a
Yeah.
huge, huge improvement. Antibiotics have played a role in that.
Mm-hmm.
Advancements in medicine, there's a lot, but vaccines have played a massive role. And I can tell you just from a personal experience perspective, and I talk to my mamas about this when I am having conversations about this, but are you familiar with the Prevnar vaccine or the pneumococcal vaccine?
Mm-hmm. I just got
So,
it for my son too. Yeah.
yeah. So
Mm.
they get those doses in those first few months. Well, when I left residency training in 2001, I was an expert at doing spinal taps. And do you know why?
Mm-hmm.
Pneumococcal bacteria. We used to see lots and lots of kids with meningitis for
Mm.
various reasons, but pneumococcal was a big one. And that vaccine was introduced in the late 90s and it became a universal thing. And so for the last almost 30 years, most children have received in the developed world have received the pneumococcal vaccine, which means that they are not only immune to those things and protected, but because so many of them have been protected, it means that there is less of that bacteria circulating in the population. So less people carry it in their nose. Less people carry it in their throat, the really bad strains. And I've actually seen the differences not only in childhood meningitis, but it's actually changed antibiotic prescribing. Like we've seen a lot less ear infections that make kids really sick since we've vaccinated them for it. So when I see an ear infection, typically they don't have 103 fever when 25 years ago they would. They would get very sick a lot of times with those ear infections, and a lot of that was because of Streptococcus pneumoniae. And so now that it's less prevalent, it's still there, but it's less prevalent. The infections from that are much more rare. Pneumonias, children hospitalized with bacterial infections is just such an unusual thing. And I think because those things are private, a lot of times the public is not privy to that information and they don't
Yeah.
see it. And when you don't see it, it doesn't seem real. But I can tell you in my own personal experience, I've watched the shift. And in the late 90s, we even changed the amount of amoxicillin that we prescribed. So we used to give a much lower dose, and we switched to a high dose amoxicillin prescribing because the low dose didn't treat it. It was more resistant than that. And so that's the other thing to consider with these vaccines is that we're preventing these infections and decreasing the incidence of this bacteria, and it's also being exposed to less antibiotics. So we're going to have less antibiotic resistance when we have less infections to treat. Right? So, and it's very important for us to be cautious and judicious with our antibiotic use because of the risk of inducing that resistance when we expose these bacteria to antibiotics over and over.
I
Does
mean,
that make sense?
newborns, absolutely, doctor. Newborns are so fragile, and I feel so sad when I see some moms putting their babies at risk. I mean, yes, you can do whatever you feel is the best for you and your baby, but
Yep.
there is science behind this.
Yeah.
There is nothing about instinct here that I feel it's not good for my baby. This is science backed, right?
Yes.
There's like we have to trust the modern medicine.
It absolutely breaks my heart. That's part of what's driving me to do some of what I'm doing because I know what the end point's going to be, and we don't
This
want.
is something they cannot even reverse. That's the worst
It may
part.
take a generation to reverse it or more. And I don't know if you've considered this, but if you have a segment of the population that chooses not to do this and you get enough of them, first of all, we're going to have more of those things circulating and you'll start seeing the incidence of these things rise. But the other thing that we will see happen is when this population grows up, we're not accustomed to seeing babies whose mom got infected with X, Y, or Z while they were pregnant, right? So we don't see congenital rubella anymore. We don't see kids who are deaf from that anymore. And when I was a child, there were always kids who mom had had some sort of infection during pregnancy. And then, in that way, it wasn't the good old days because there were lots of those poor children who ended up with long term disabilities related to a maternal infection. And
Yeah.
it's not gone. We're not immune, right? So as a population, we're still very much sitting ducks. And there are people who don't respond to their vaccines. So just saying, well, they can do it, but I'm not going to do it. The problem is when you lose that herd immunity, when you get the numbers below a certain level, then you'll start seeing an increase in those infections. And occasionally it'll get somebody who's had their vaccines because they didn't respond well, or their immune system was a little different or a little more susceptible for some reason. Whereas if you have that herd immunity, everybody's protected.
And also, when somebody chooses not to vaccinate their baby, they are not only putting their baby at risk, but they are putting other people and their babies at risk too.
Yes, and the more of that there is, the more risk that we're going to lose all this protection that we've created. It's almost like it's defeating itself because it's been so successful. No one believes in these things. I mean, diphtheria is a Victorian disease, right? I mean, I've never seen diphtheria, but shoot, I don't want to. And I can tell you those bacteria are still out there, and I've never seen polio. Um, and I don't want to. But I'm afraid that if there's enough of this, then that's what we're going to start seeing.
We were talking about pneumococcal vaccine, and this vaccine is given at 2 months, 4 months, and also 6 months. So
Yeah.
three times
Yep.
within the 6 months of life.
Yep.
What's the reason? And this is out of my own curiosity, because now I'm being on top of the vaccine card, and I see like, okay, this is something we are getting like in every vaccine visit.
So the reason that it's done that way, and this is all based on scientific research, but that so giving it at certain times and giving it a certain number of times is important because you're training their immune system to recognize it. And their immune system is developing. So as it develops, you're giving these small exposures to these antigens that are in these vaccines, which it's almost like a lock and key. So when you give that baby the vaccine, you're not giving them the sickness. What you're doing is you're giving them some proteins, usually from the surface of that particular organism, so that there's a match made in their body to that. And so when the day comes when they do get exposed to that particular bacteria, their immune system won't overreact, but it takes multiple exposures to gain that protection. And then there's also a booster. So you get the first 3 doses, and then there's that booster at 15 months or 12 months,
Yeah.
whenever your doctor gives it. But
Now let's talk about vitamin K shot.
okay.
And a lot of moms also dismiss that in the hospital, but we know how important it is. And let's
Right.
talk about that. And if you have any like any theories supporting any evidence like for the babies who did not get that.
So I haven't looked up the actual incidence, but the reason that we give vitamin K at birth is because all newborns are vitamin K deficient. And vitamin K is made in the gut. And the newborn's gut is virtually sterile. And the vitamin K comes from the bacteria that have colonized the gut. And that doesn't really, and it can also come from like leafy green vegetables and things like that. But clearly, we're not going to give our newborn spinach, right? But it's something that if they don't have enough, vitamin K is involved with clotting. And there is a certain subset of babies that will develop something called hemorrhagic disease of the newborn. And I'll have to look up the incidence for you, but it definitely happens, and they can bleed from anywhere. So they could bleed from their nose, or they could bleed from their mouth, or something like that. But it usually takes a few weeks, and it'll onset sometime in those first couple of months. But they can also bleed in their brain. And so the simple vitamin K shot is just vitamin K. It might have some preservatives in it. All of that stuff has been studied. It's been vetted. It's kept in and the preservatives are there to keep from giving your baby a bacterial infection when you give them the injection. But it's all very carefully vetted, and there's no complications that come from that other than potentially maybe some injection site thing or whatever. But it's not going to cause any medical problems. It just prevents your baby from getting. It's like putting on a little armor, and it prevents that condition. And that condition can be devastating. It can result in death, but it can also result in a lifelong disability. If you bleed in
Yeah.
your brain, it's like having a stroke when you're a baby. And that
Yeah.
simple shot prevents that.
Yeah, I think parents are focusing a lot on the synthetic components involved in the vaccination, but not really considering that the risks that they are potentially inviting by not giving that.
Well, and once again, it's all private information, so it's very invisible to most people. But
Yeah.
in my world, it's not. So we want to protect the babies. That's really the goal, is to keep babies well and safe. And yes, there's a big industry there, but that industry is actually important because without it, there wouldn't be there wouldn't be these things. We wouldn't even have them because they're so expensive to develop and to have. So, it's not all good or all bad, right? So there's some good and bad and everything, but I think it's actually pretty important.
Yeah, of course. Like from your expertise, I'm glad that I had you on the episode today because we really don't want to just go on the internet. We don't want moms to go to the internet and do what some mom in the States or in Canada is doing, but rather go to like a pediatrician and maybe ask questions.
Sure.
If you're not sure, just ask questions instead of, doing something that you just see randomly on Reels or,
Right.
TikTok.
If you want to check something, there's two resources that I tend to give to my patients' parents. And one is, so if you're curious about vaccines and you want to look up something that's not a government site but it's valid information, you could look at Children's Hospital of Philadelphia. They have something called the Vaccine Education Center. And their infectious disease pediatrician is an amazing guy. His name's Dr. Paul Offit. But he's made a whole series of videos explaining the questions that people ask on Google about vaccines. So he's got like a whole YouTube thing like where he answers all those questions. That's who I would look to. That's a resource you can really trust. And then healthychildren.org is another great website. Have you found that one yet?
I did not look for it because honestly telling you, I was trusting my doctor and I did not
Well,
question.
so that's
But
that's
yes.
actually a site that's made by the American Academy of Pediatrics for parents.
Mm-hmm.
And so it's a place that explains different topics, whatever, and it has a search bar. So you can go there
Oh,
and search instead of using Google.
Google, yeah.
Yes, and depending on AI to get it right, because sometimes AI just hallucinates and
Oh,
doesn't
yes,
get it
I
right.
agree.
So, and there's
Yeah.
enough information circulating now that I'm even more wary of it. But the healthychildren.org is a great site because you can look up pretty much any topic and you'll find multiple articles explaining all.
Good to know. Good to know. I'm sure a lot of mom listeners are going to now look at this website and why not search there instead of just searching on Google?
Right. And you'll find the answers to your questions and you can trust it. Yeah.
Finally, Dr. Leslie, I would like to close this session by instilling some confidence in new parents, especially moms. If there's anything, happening with the baby, if there's anything that they're worried about, if there's any advice that you want to give them, first of all, or any concerning signs for a newborn phase, 8 weeks, any concerning sign that parents should look for and then seek medical attention from the doctor.
Absolutely. So the one of the things that I tell all of my newborn visits and my 2 week visits, or I remind them of, is our fever guidelines. And I'm going to give it to you in Fahrenheit, but I could probably figure it out in Celsius too. But 97 is kind of your low end of normal. And we always measure temperatures rectally in a newborn. So we can screen them under the arm or check it in their ear, but it's not as accurate. So if you're questioning if your baby is too hot or too cold, check a rectal temperature. But if you get a number below that 97 degrees rectally, then that is concerning that your baby might have hypothermia. And if they have hypothermia or if they have a fever, those are both urgent and emergent in a newborn, in a young baby, because of their immune system being so vulnerable. The upper end of normal is 100.4, which I believe is 38.2, but look it up. We just always use Fahrenheit, and it's been a minute. So, but it's 37 is 98.6. I believe it's 38.2. But if you get above 100.4, that's technically a fever, and you're going to want to seek medical attention right away. That shouldn't even wait like overnight. That needs to go in right away, because newborns and babies under 3 months old are susceptible to blood infection and brain infection. So their blood-brain barrier is still pretty underdeveloped, and their immune system is kind of like a cancer patient on chemotherapy. Like, it's that weak. So they're very vulnerable to any kind of virus that you or I could get, but they're also vulnerable to getting their blood infected. And that'll be typically one of the things you see. You might see your baby being lethargic and not willing to feed,
Okay.
or really hyper irritable and inconsolable. And jaundice is another thing that could indicate infection, but most of the time it doesn't. It's usually, something that happens in that first week. And you should be closely followed up if your baby has jaundice. But if your baby's not feeding well at that time, that would be another reason to go in right away. If they won't wake up to eat.
And when we were talking about vaccines, there's one more question I
Sure.
wanted to ask. It just came to my mind now. When we are taking our babies for vaccination, me personally, I think my baby doesn't even know what's going to come next, right? But I am so nervous and I don't really want them to be at the discomfort and then screaming and crying. Do
Right.
you have any trick that can ease the baby, or how can we comfort the baby when they're getting the vaccine?
You mean like when they get the shots?
Yeah.
I mean, some people like to breastfeed while their baby gets their shots or breastfeed afterwards.
And does that help when we are breastfeeding and the baby is getting shot? Do you think it's not going to give them that kind of shock that they cry so much?
Yeah, and I think the crying is brief, and I think I cried with both of my
Yeah.
first two sets. Those it was
Mm-hmm.
tough. I remember, and you don't want to give Tylenol before the shots because actually there's some evidence that
Mm-hmm.
Tylenol blunts the immune response that you're going to have to those shots before if you give it beforehand. So you want to wait, let their immune system respond. So if they're fussy a few hours later, that's when you want to give that Tylenol.
Okay. I'm
But
surprised
but it's
people give it before too.
sometimes they still do. A lot of grandparents will instruct the parents to do it because that's old advice. That's what we used to tell people 20 years ago. But there was
Mm.
newer evidence
Yeah.
to. So that's one of those things that medicine changes and evolves, and
Mm-hmm.
things change over time. So always just check in with your doctor if you're not sure. But in my office, we don't recommend it because of that.
When can we give the Tylenol though? How many hours should we wait if the baby is having so much pain and if we really need to give it?
I think if they're uncomfortable, that's what I tell my patients, and they should always ask their doctor. But if they're uncomfortable, a few hours later they're starting to get fussy, then do it. You can always use like a cold pack on the site,
Okay.
because sometimes they'll have a little knot where they got the injection, or they'll have a little discomfort, their little redness, and the cold pack should help with that as well.
Okay.
But yeah, I think if they're fussy, go ahead and do it, but just don't do it ahead of time. Don't do it
Got it.
preparing for it, because part of the
Mm.
reason they feel bad, I don't know if you know this, but part of the reason that the vaccines make babies feel bad is because their immune system's actually responding to it.
Yeah.
And so it's like when you're
Yeah.
coming down with something and you have all these chemicals that your body releases to respond to that infection. It's the same
Mm-hmm.
chemicals that make you feel bad after you've had a vaccine.
Thank you so much, Dr. Leslie. This episode was so good. But anyway, there's a lot of things that we still have to talk about, and we'll probably come back with another episode for our new parents. It was wonderful talking to you. Thank you so much for sharing so many insights and your wealth of knowledge. I really appreciate it.
Thank you. You're doing an amazing job.
Thanks a lot.
Thank
Thanks.
you.